if you're sitting here and you're like, okay, doc, talk to me about my back pain. Here's what I'm gonna say to you guys. If you have pain that gets worse when you lay on your stomach, meaning like, so when you're in bed, you cannot sleep on your stomach because of low back pain, it's a high likelihood that your pain is most likely coming from your facet joints or your sacroiliac joints. Now, it might be from the posterior cutaneous branches of the dorsal rami, which are the cutaneous branches that come off of these, the dorsal rami, which come off of the nerve roots at each of the levels. That's a lower possibility, but it's still possible. But most of the time, if you're laying on your stomach and that causes you a great deal of pain, it is likely your facet joints or your sacroiliac joint. If you have trouble getting up from a seated position, meaning like when you're on the toilet or you're sitting down for a long period of time, and when you go to get up, if that causes you low back pain, there's a high likelihood that that is actually sacroiliitis or inflammation and some mild arthritis of the sacroiliac joints, whether it's just one side or both sides. And then the other layer to that, the next thing I would look at if it wasn't sacroiliac joints would be the superior and middle cluneal nerves. Again, as when you go to stand up, what happens is the posterior aspect of the pelvis compresses, it opens up a bit, which gaps the sacroiliac joint. And when that happens, that can cause pain for your sacroiliac joint, but also the muscles of your lower back, so your erector spinae muscles and your glutes have to contract when you stand up to create tension. And if the nerves that are going through those muscles or through those fascial planes, when you clamp down on them, that could irritate them and that could cause you pain. And so again, standing from a seated position could be sacroiliitis or it could be the superior middle cluneal nerves. If you have pain when you look over your shoulder, okay, so let's say you're driving and you go to look over your shoulder to check your blind spot or check this way, and you have low back pain that's around your sacrum, then that could be sacroiliitis as well. But again, it could always still be the nerves. And then if it's a bit higher up, meaning it's kind of above your iliac crest, which is the pelvic bone there, then that could actually be your facet joints. And then the last one is if you have pain that gets worse when you bend forward. Now, this one can be a little bit tricky because, when you bend forward, you actually place, what happens is you have your discs here, okay? This here is the posterior side, this here is the anterior side, okay? When you bend forward, what happens is you compress the front side of the intervertebral discs, and what that does is it kind of pushes and smushes what's called the nucleus pulposus inside the disc. It actually pushes it backwards a little bit, okay? And so if you have a tear in the annulus, which is the ring around the intervertebral disc, or you have a frank herniation or something like that, what happens when you do this is it's kind of like a jelly donut, right? You push on this end and it could squirt out this end. So the herniation, the nucleus pulposus, could come out the posterior side. And so when you flex forward, and if you have low back pain, that could possibly be a disc issue. Now, if you do that and you have pain that goes down into the leg, right, whether it goes to the back of the leg, the side of the leg, into the foot, then that could be a disc bulge or herniation pressing on the nerve roots, okay? But if you kind of have more diffuse low back pain, especially like right around your sacrum and your SI joints when you bend forward, it's actually most likely your cluneal nerves that are causing that. And the reason I say that is because when you go into that flexion position, what happens is you're taking all of these muscles that kind of have, here, let me try this. You've got the nerve that's piercing through these muscles, right? And what happens is you've got these fascial layers in the muscle, and when you go and you stretch the low back, right? Because going into a forward flexion position is going to stretch the muscles of the low back. When you stretch, what can happen is you can actually pull tension on those nerves. And if those nerves are inflamed and irritated and they have neurogenic inflammation, then that stretching can get to a point where it starts to fire off pain signals. And so you can then have pain because of that. Now, if you arch your back up like this and have pain as well, and it's not your facet joints, it could still be nerves. So the nerves can kind of go both ways in that sense, meaning when you stretch the nerve and when you compress the nerves, you can have pain on both of those. So we already explained the stretching, but then the compression part is if you have this going through a muscle, or we'll do it like this, you have this going through a muscle, and then you squeeze the nerve, right? So you're here, and then you contract the muscle and you squeeze, you're now squeezing on the nerve, and that compression on the nerve can again send off pain signals. And so the nerves can always be in play, and a lot of the times, I'd probably say 90% of the time, if I have a known, it's a sacroiliac joint, or it's a facet joint, or there's an annular tear, anything like that, there's a structural issue that we're more commonly talking about. If we have that, I'd say 90% of the time there's also overlying neurogenic inflammation that is contributing to the pain. And so a lot of the times I'm actually treating both of these things together. Now, if you have had back surgery, the chances of you having neurogenic inflammation skyrocket, because when they cut through those muscles, they're changing how the fascia moves, they're changing how muscles can contract, they are changing the tissue integrity there, which is important because nerves can get trapped in scar tissue. If things don't slide properly, nerves can get trapped in the fascia or the muscles more, and so there's always a higher chance of neurogenic inflammation in anywhere where there's been surgery. So that's kind of where I wanted to go with this video, is just kind of talk about, some different ideas on why you might be having back pain. Now, on the treatment side of the equation, there's many different ways that you can treat low back pain and get resolution. What I personally specialize in and what I enjoy doing and what I find really effective is the regenerative injection therapies. That's things like prolotherapy, PRP, autologous stem cell therapy, the perineural injections, nerve hydrodissection. All that stuff is really beneficial in cases like this, because we are attempting to get at the root cause of the actual tissue dysfunction, which is usually some form of neurogenic inflammation, tissue inflammation, and or tissue degeneration. And so based on what we have going on, we can choose the appropriate therapy to help patients get out of pain long-term, the way that I've been helped to get out of pain long-term. So I hope this helps give some clarity for all of you out there who are suffering from low back pain. And if you have any questions, please hop in the comments and let's try to discuss it. See you later.